I am within my second semester of completing a journey to become a registered nurse in California. I am attending Merced College, my local community college here in Los Baños, in hopes of this journey of accomplishing this journey of becoming a registered nurse. Um, within within taking this journey, I've learned a lot, and I've asked myself a lot of questions. Um, what does the job require? What are some of the curriculums that I have to complete in order to accomplish my goal? Um, what are the wages, the longevity? Um, what would life be like as a nurse? Um, Within all of this, I found that in California, the increased demand on the healthcare system creates a need for registered nurses. Obtaining a registered nursing license requires normally the completion of 120 credit units, 60 credits for foundation courses, and 30 for advanced courses, and 30 for clinical training. So basically, a total of 120 units is required. 60 are going to be standing critical, 60 are going to be foundation courses, 30 advanced courses, basically in what area of specialty do you want to go into. There are different areas of specialty, advanced courses that you can go into cardiovascular, um, respiratory, um, biological, and so on and so forth. Um, and also, there is a 30 unit clinical training. So that's hands on work that you would have to do at hospitals volunteering in combination with the educational bookwork that you are learning as you're going along. The question then becomes, are the educational courses set by the California State University and College Council a proximity to pursue a career in the healthcare system as a registered nurse, up to expectations for the job? Should a change in the standing curriculum happen? Are students needing a change? Um, the question here basically is, what are the standards placed by California State University and College Council um, in order to be eligible to take the exam for licensing through the Board of Nursing in California? And are they adequate, or do they meet the actual needs of the workforce, medical workforce, healthcare workforce, and how are they interlapping and reacting to each other? Is what you're learning being transitioned practically into your work field, which is nursing? Within this question, we ask ourselves what needs to happen, what steps needs to take. First of all, are the courses that are set adequate enough? Are nurses feeling 100% confident once they graduate and start to work? Are they not? And what areas are they not feeling comfortable in, or what areas do they feel like they need more help in? Analyzing that and figuring that out with nurses already in the field are going to help upcoming students that hope to be within their own field, which is the nursing. Now, it is noted to say that little research has been done in this area of, let's call it the first 5 years of your nursing career. Little research has been done, but there has been studies. There has been studies done. In 2012, An article was published and released by author Lars Willy, in which he kept record data, spreadsheets, and kept written notes, tabs on 1,501 nurses, recently graduated nurses, for a spread of 5 years. They learned a lot during this study, and basically what they learned was that 60% of nurses that um, graduate the requirements and complete the requirements to become a registered nurse and become a registered nurse. Once they go forward to actually working in the environment, which we said 60%, which is the most higher portion of it, go into hospital. What kind of setting are they in? And what's going on during that time. Um, they also found that within the 5 year length of keeping track, that nurses felt like they needed help with exercising clinical practices. That's the area that they felt like they needed more more help and strength to develop, which does happen over time. But that's the area that they felt like they lacked the most at when they graduated from their studies. Additional studies have been made, some of them by the U.S. Army Hospital and other branches of the government as well. So, according to the Nursing Board of Labor Statistics, based on the information gathered from what we can see in today's healthcare environment, registered nurses are required to do the following things. U.S. Bureau of Labor Statistics put an article up to Occupational Outlook Handbook, what registered nurses do, and they give a 10-point list of what are the top 10 things that um, registered nurses are expected to do and perform. A lot of the things: um, access patient conditions, record patients' medical history and symptoms, observe patients and record the observations, administer patient medication and treatment, set up plans for patients' care, along with a lot of other stuff. Um, require multi skills. They not only require book work, academic learning, as set forward with what we see is needed to accomplish an associate's degree, but also are we maybe lacking something there? If these studies are being conducted and they show that nurses are facing or struggling with the experimental educational application part of their studies. What can we do to fix that? In conclusion, I think that maybe adding, not necessarily taking anything away that is already there, but just adding additional units for clinical uh, trials, clinical correlation, working within the environment, within hospitals, within volunteering centers, and uh, mixing in that educational book work with a hands-on working environment. Would that help? I think yes, that would help. That would help nurses that are going into the work field as recent graduating students.